happens when we hear the helicopter, we know from the news that there has been a car accident, and then we hear the patient is in stable condition at the hospital. What has happened from the helicopter to stable? In my opinion, it is nothing short of spectacular.
On an average day, there's general orthopedic stuff and there's trauma stuff. There's 7 of us in the group. We all have a subspecialty, and mine's complex highway trauma, and that usually involves pelvic injuries and injuries to bones such as the calcaneus and the talus, and then complex injuries around a joint, which are called periarticular, which would be the distal femur or the proximal tibia or the knee joint or the elbow joint, etc.
Trauma is indeed a multidisciplinary approach. You have patients who have sustained significant injuries, which often involve various organ systems. The specialists that are involved in their care, such as EMS, begin resuscitation, bring them to the emergency room where a trauma team physician is in charge of the global care of the patient, but is assisted by numerous nurses. They're transferred to the operating room where anesthetists sort of assume the care of the overall patient and resuscitation, whereas the surgeons work on their individual areas. And in the ICU, again, the multidisciplinary approach is maintained with ICU doctors. Lots of nursing resources, dietitians are involved, physiotherapists to assist with the rehab of the patient afterwards, respiratory therapists when the patients are on ventilators, as well as the laboratory. These patients are very complicated and need extensive resources to aid in their management.
This is a state-of-the-art operating room. It is probably unequalled certainly in Ontario, if not Canada. There are ORs larger than ours for sure, but we actually are one of the largest ORs in Ontario.